How to get private health insurance in Europe as an American. Are you an American dreaming of living, working, or retiring in Europe? One of the key aspects you need to consider is how to get private health insurance. Your United States health insurance, including Medicare, usually does not cover medical expenses abroad. This makes securing local or international private health insurance a must. First, it is important to determine your residency status and the country you plan to move to. Each European nation has different health insurance requirements. For instance, if you are looking at countries in the Schengen area, you will need travel insurance that covers at least €30,000 for emergency medical expenses. This is especially important if you plan to stay longer than 90 days or apply for a visa. If your stay is short, under 90 days, a travel insurance plan that meets Schengen requirements may be sufficient. However, for longer stays or if you are applying for residency, you will likely need a more comprehensive private health insurance plan or access to the local public health care system. This often requires contributions to Social Security or proof of residency. To get started with private health insurance, research the specific requirements of the country you are moving to. For example, in Germany, expatriates must show proof of health insurance and can choose between public and private plans. In France, after 3 months of residency, you can access public health care, but many expats opt for private insurance initially. In Spain, private insurance is recommended if you do not qualify for public health care right away. Next, compare private insurance providers. Look for international or local insurers that offer plans tailored for expatriates. Pay attention to coverage details such as emergency care, hospitalization, outpatient services, and whether pre-existing conditions are included. Also, check if the plan covers medical evacuation and repatriation, as well as the network of hospitals and clinics available in your area. It is wise to purchase your insurance before you arrive in Europe or early in your stay. Some visa applications requiring proof of insurance before you enter the country. Even if it is not mandatory, having insurance from the start can protect you from unexpected medical costs. Consider international health insurance plans designed specifically for expatriates. These plans often provide comprehensive coverage across multiple countries, which can be beneficial if you travel frequently within Europe. Keep in mind the European Health Insurance Card and the S1 form. These are only available to legal residents enrolled in a European country's public healthcare system and do not apply to Americans without residency or contributions to that system. Therefore, private insurance remains essential unless you become eligible for public coverage. Lastly, seeking professional advice can be very helpful. Insurance brokers or expatriate services can guide you through the complex options and ensure you meet both legal requirements and your personal health needs. In practice, Americans moving to Europe should plan ahead by researching the healthcare system of their destination country. Securing private health insurance that meets visa and residency requirements is essential. Make sure your policy covers emergencies, routine care, and any specific health needs. This approach will help you stay compliant and enjoy peace of mind while living, working, or retiring in Europe.